In the coming days, government will be rolling out a screening, testing, tracing, and medical management program on a huge scale. Around 10,000 field workers at the moment will be visiting homes in villages, in towns and cities to screen residents for the coronavirus symptoms. People with symptoms will be referred to local clinics or mobile clinics for testing. People who are infected with the coronavirus but who have no or moderate symptoms will remain in isolation at home or at a facility provided by government, and those with severe symptoms will be transferred to hospitals.
Well, good evening and welcome. South Africa has made it through the halfway mark of the 21-day lockdown aimed at curbing the rapid spread of COVID-19. And the last few days have proven difficult for social distancing for especially poor South Africans and those living in dire conditions. Lack of space, shortage of food, and the challenge of keeping young children engaged in confined spaces have been hard to tackle. As an unintended consequence, the rest of the population have also been seen a significant reduction in crime, but domestic violence has increased sporadically despite strides made in a bid to contain the virus. Experts say the total number of people testing positive for the coronavirus in the country is an underestimate of the burden of COVID-19. Experts say the number of confirmed cases is lower than the number of total cases due to the limited and/or restrictive testing criteria. Over 1 million people worldwide have been infected with the disease and more than 54,000 have since died. South Africa has this week intensified its campaign to test as many people as possible. Some of the priority areas for action included upscaling countrywide diagnostic capacity, safety and protection of frontline healthcare personnel, increasing access to mandatory flu vaccination, and so on and so forth. But our guest tonight is ophthalmologist Dr. Khosi Letlape. He'll be joining us later on the show. He's also a leader in medical circles, as well as Professor of Vaccinology at Wits University, Professor Shabir Mahdi. He's also the Director of the Medical Research Council, Respiratory and Meningeal Pathogens Research Unit. Professor, very good evening and thank you so much for joining us. Have we done enough to mitigate the impact of COVID-19? That's our question for tonight on Unfiltered. And you're welcome to join us in this discussion on Facebook and Twitter using our hashtags at SABC News Online and SABC News Unfiltered. Professor, let's bring you into the conversation. Thank you so much for joining us this evening as we reach the halfway mark for the 21-day nationwide lockdown. South Africans are a bit uneasy about the detail and the efficacy and the possible extension of the lockdown. What is your assessment of the movement of the curve as the infection rate approaches the 1,700 mark?
Okay, so good evening and thank you for having me. So I think the reality of the situation in South Africa currently is that we really don't have a good handle in terms of the true number of individuals that have been infected. Unfortunately, because of a variety of reasons, our ability to actually reach out in the communities to do testing at scale has been very limited. In fact, if you look at the number of individuals that have been tested in South Africa up to now, it's just over the 50,000 mark. Whereas what we should be doing is aspiring towards testing close to between 50 and 35,000 people per day to really get a good idea in terms of the extent of the circulation. Now, with all of the constraints that have existed in terms of being able to test, like I said, it's really difficult to actually figure out exactly how bad the circulation of the virus is in the country, as well as how many people have been infected. That being said, I think it's important also to recognize that South Africa is not unique in this regard. Even high-income countries such as Italy, such as Spain, have very much underestimated the true number of individuals that have been infected. In fact, the data suggests that in a place such as Italy, which has reported over 100,000 cases that have been confirmed, as many as 5 million individuals might already have been infected up to now. So we do have major limitations in terms of the amount of testing that's been done to be able to really quantify as to what sort of inroads we've made in terms of containing the circulation of the virus.
You actually quoted in a health expert article titled "There's an urgent need to upscale COVID-19 testing facilities," where you say the total number of people testing positive for the deadly virus in South Africa is an underestimate of the burden of COVID-19. And I'm going to ask you to think about just unpacking that for us, just as we introduce our other guest, Dr. Letlape. Thank you so much for joining us this evening. The last time we spoke to you, we were encouraging South Africans to social distance, to just go a notch up in terms of their hygiene, and there wasn't a lockdown then. Since then, do you think there's an improvement?
Yes, I think there's increased awareness now about the importance of hygiene. And unfortunately, because of an uneven society, we're not talking to all South Africans. As has become evident, some of our communities are only getting the news now about corona, and we need to do more to educate all South Africans about the pandemic that we are dealing with.
Dr. Madu, let's just get back to you just in terms of what do you mean when you say the current figures are an underestimate of the burden of COVID-19 at the moment?
Okay, so there's multiple layers to it, but I think the most important aspect of it is for us to be able to get a good understanding in terms of the true number of individuals that have been infected. We need to have a very low threshold at which we actually investigate individuals. Unfortunately, until very recently, that threshold was really geared towards identifying individuals that had a travel history or were in contact with someone that was known to be infectious. So what I'm saying is that what we need to do, and this is what the President announced a few days ago, is we need to go down to the communities, down to the street level, to be able to investigate at each house in terms of which individuals might be manifesting symptoms of a respiratory viral infection, and those individuals then need to be tested. So where should we be with testing? A good example in terms of successful interventions in containing the epidemic comes from South Korea, where during the period of circulation of the virus at its peak, what they were able to do is test roughly one individual for every 150 people in that particular population. Currently in South Africa, we're testing 8 individuals for every 10,000 of the population, which is completely suboptimal. So in the absence of us actually scaling up our testing and doing it at the community level, down to each household almost, we're not going to be able to quantify the true extent of the circulation of the virus, as well as the true extent in terms of the number of individuals that have been infected currently. What we're already seeing emerge, unfortunately, in our hospitals, and a good example is the hospital in KwaZulu-Natal over the weekend, where 27 healthcare workers were infected because of one case that wasn't actually recognized as being a possible case of COVID. So under those sort of scenarios, what we're facing is essentially community circulation of virus, which is going by unnoticed, and we're only picking it up when the healthcare workers, as an example, are becoming infected, which is suboptimal.
Dr. Letlape, I don't know, do you agree? Although the infection rates are going up, South Africa has been praised for having one of the lowest mortality rates in terms of COVID. Is it too early to tell?
And we have to understand that we attack from both ends. It is important to see how so that those that are affected need to be isolated. But the aim should always be to stop the spreading of the infection. Now, hygiene becomes important.
All right, Dr. Letlape, I'm going to ask our producers to clear up your line.
Should not replace each other. They should be synergistic. So we need to forge ahead and do more.
All right, I'm going to ask our producers to clear up Dr. Letlape's line so that we're able to to tell, especially for the benefit of our viewers, exactly what he's saying. But Professor Mahdi, let's come back to this concerns about the so-called 1 in 4 people who are asymptomatic carriers but are still able to transmit the virus. Is this the case, and how contagious are these people?
Yeah, so that's really unfortunate in that over the past week or so, we've learned much more about the virus compared to in the past. And what we've come now to recognize is that, in fact, individuals that are completely asymptomatic, or even some individuals that are what we call pre-symptomatic, that is before they start manifesting any symptoms of the infection itself, they actually seem to be able to spread the virus through contaminated droplets, either by even simply by speaking to other individuals in the immediate vicinity. They could infect those individuals, or they could actually contaminate the environment with the droplets. So this, unfortunately, is of great concern because it tells us that by targeting symptomatic individuals, it's important to isolate those known cases. But in addition to that, there possibly is a large pool of individuals that are infected that we would never know that they're infected unless we test every individual, which obviously is not pragmatic for multiple reasons. So the additional knowledge in terms of the possibility of these asymptomatic individuals being able to spread, to be able to transmit the virus in the community is something of major concern. And that's the reason why different organizations are reconsidering some sort of strategies, especially as an example, the use of face masks when people go out into public spaces.
Dr. Letlape, the practicality of testing more than 50 million South Africans, is this achievable?
I think the aim is not to try and test everyone, because the cost implications will be quite high and the time that you need. But the important thing is contact tracing and ensuring that people that have been in contact with a person that's known to have COVID or that's suspected of COVID can be tested, can be traced, and should be tested so that we see how far it is spread. We're still not in the realm of trying to give everybody a test. That would be difficult. Tests are also not readily available. The different nations are competing for the number of tests that are available. Testing materials are quite scarce. So even though testing is important, containment of the disease and the hygiene measures are also critically important. But more importantly, it's compliance of citizens. If you've been in contact with someone, if you've had a test being done and you're awaiting results, please do not move. If you're found to be positive, don't become a vector and start moving from the area that you are in. Give a complete list of the contacts of people that you've been in touch with, and testing will be confined to those people that are traced to have been in contact with someone that is positive. We can't aim to test 53 million people. But people have to understand this. Compliance with what has been communicated, compliance with the lockdown, hygiene is extremely important. Physical distancing is a key to winning this issue. And as my colleague said, because of asymptomatic spread and people that start shedding the virus and spreading it before they even show any symptoms, it's important that when we go outside, we cover our nose and mouth. But what is important is that we should not compete with the healthcare setting for surgical masks. Just cloth masks for going out, but that is to ensure that if you are one of those that might be carrying COVID and you are not symptomatic and you are not aware, by covering your nose and mouth, you are reducing the opportunities and the chances for you transmitting it to others. You are basically protecting others rather than protecting yourself. And it's time we go back to being altruistic. And if we come up with the attitude of, how do I ensure that I protect others from me, then we will be protecting each other.
I'm glad you're bringing up the issue about cloth masks. We'll talk about that after the break. And I'd also like both of you to think about the strategy of government in terms of how they're rolling out the door-to-door testing. Let's take a break for now. You're watching Unfiltered.
As government, we are aware that the lockdown has caused great disruption to all our lives and caused upheaval in our economy. But we all know and agree that this nationwide lockdown is absolutely necessary to save the lives of thousands, even tens of thousands of our people. Coronavirus pandemic. It infects the rich and the poor, the young and the old, black and white, those who live in the cities and those who live in the rural areas. Let us not make the mistake of thinking that this is somebody else's problem.
Welcome back. You're watching Unfiltered, and our conversation tonight about the rolling out of those mobile testing stations by government. Our conversation tonight with Professor Shabir Mahdi. He's a vaccinologist at the University of Witwatersrand. He's also with the South African Medical Research Council. And we're also in conversation with Dr. Kgosi Letlabe. Thank you once again, gentlemen, for joining us this evening. Let's just try and unpack that strategy by government. But before we do that, let's take a listen to a few voice notes that our viewers have sent us tonight.
Yes, I do believe they are forced to shut and lock the whole country, because if they don't do so, a lot of people will die while the dead is rising. It's no longer the same as it was again. So there is no need to allow people to go around and so on. They need to close everything, shut it down. Simple as that. They are forced to do so.
I think failure to extend the lockdown will really defeat the objectives of lockdown, because that we are going to see a very huge number of new cases going up, and that will take us back to square one. So it would be advisable for the president to extend the lockdown period.
For our president to make an extension on a lockdown, okay, it might be a good idea, but let's not forget that it might cost a big knock on the companies, which might result in retrenchments. And the fact that our economy is limping at the moment, it might cost a big knock on our economy.
I personally think that the lockdown should be extended. This might be a tough decision, but it's the best decision to take in the best interest of public health. Yes, the government is to come up with various ways of bailing out the economy, and the government should also consider making sure that there are adequate and constant food supplies and medical supplies to the citizens.
Very important contributions there. We really appreciate them, but we just want to know who we're talking to. So as you send those in, please let us know who you are and where you're calling from. But let me just bring in my guests once again. And Professor Mahdi, I will start with you. That conversation with our viewers that we're having tonight about fears of a possible extension of the lockdown. Should the lockdown be extended?
Look, it's early days to tell, but I think the important message here is that a lockdown on its own does not get rid of the virus. What the lockdown achieves is that it firstly limits the circulation of the virus to individuals. But the main reason for the lockdown is for us to become much more efficient, which we go about, identify individuals in every household that might be infected, and then test those individuals and put them into isolation and put the context of those individuals under quarantine, and observe them to make sure that they have not become infected. In the absence of actually doing that, a lockdown, in fact, will achieve very little. And that is one of the Achilles heels in terms of our current approach to the lockdown, is that we haven't been able to scale up testing to the extent that we need to test. So again, a lockdown on its own, irrespective of whether it's for 3 weeks or 5 weeks, in the absence of actually being able to identify cases at a household level, put those individuals under isolation, quarantine other members in that household, it's really not going to achieve much. If anything, what would happen is that after this lockdown is actually lifted, in absence of us having put into place the strategy of test, isolation and quarantine, what we would probably see is a marked rebound in terms of the number of cases and an acceleration in terms of the number of cases. So it's not so much a matter as to how long the lockdown should last. It's really an issue as to what we actually do during the context of that lockdown in terms of being able to identify the infectious cases, to try to bring about an interruption. The other reason for the lockdown is what we're also trying to do is sort of spread out the cases that occur over a much more prolonged period of time. And that would basically assist our healthcare facilities in being able to cope with the added demand that's going to exist when we start seeing more cases of community transmission and more individuals coming into facilities for healthcare seeking.
Dr. Ntlape, just today, the Reserve Bank giving lesser projections in terms of economic growth in South Africa. How long can we sustain the lockdown for, and what needs to be done to make it more efficient?
I think we need to make a choice. This is a pandemic, and we should stop trying to we've made a choice of life is more important than money. So we can choose to save the economy and have the population dies, and there's nobody to get the benefits of the saved economy. Or you could save everyone, take the knock on the economy, and once you're beyond it, we are all there to rebuild the economy. The second scenario is what we're aiming for, and that is the correct thing to do. So I think we should just accept that this virus says, either you put me first and you deal with me, or I will take you out and I'll also take out your economy. So we should not be talking about, like Trump, wanting to get back to the economy. We must be wanting to put this under control. Now, the issue of lockdown and testing, these strategies work together. It's not one or the other. And if your lockdown is effective and you are able to reach and test many people, you're going to come out better out of this thing. Remember, the fact that there will be people that can transmit the virus before they show any signs of illness, and there'll be people that will be positive, not sick, and transmit the virus, is an important factor to take into consideration. That is why, as my colleague has said, testing, targeted, massive testing becomes important. But also, you want to limit the movement of people because you are protecting them from being infected or it being spread around. Our ability to test needs to be sharpened up sooner than later. And we should welcome, and the way the government has rolled it out, that the 10,000 people that go out are going out to do epidemiological surveys, to go into households, to find out about possibility of having in contact with people with COVID, to find out about people that have symptoms of respiratory illness, so that they can be selected and tested, so that we can see how far the issue is going. But they go together. The issue of extension of the lockdown, that's up to the authorities to do. If you look at what we've done 10 days now or 11 days, it's partial success. There are certain things where we've made economic consideration confuse our strategy on lockdown. And I think we will be clear about this before the 21 days is over, that we make sacrifices now in terms of economic sacrifices for long-term gain. And let's not try and get economic activity now, because that nullifies the benefit of a proper lockdown.
I keep saying we're going to get to the issue of the mobile and sampling and testing units, the government strategy, but other conversations keep springing up. But we will get to that. For now, it's goodbye to our SABC 3 viewers. If you'd like to continue with this conversation, do join us on SABC News Channel 404. See you on the other side.
Everyone must know that this virus will come to us one day, on one day, and therefore it's important for us to say this is just an infection like any other flu. It will affect all of us. So let's not have a stigma. Let's not discriminate against anybody. Let's support everyone so that we actually can fight this thing together.
The very hardworking Minister of Health, Dr. Zweli Mkhize there. We also really appreciate your interaction with our conversation tonight. Let's take a look at some of the tweets you've sent through. Jabulani says extension is not good for poor people. Those that are saying extend are well equipped financially. Please, Presidency, South Africa, keep prevention measures for a year, but free people to go to work. Enough is enough, please. Prime Minister of Wakanda saying it should. People are not complying. My neighbors are having visitors as we speak. And Disang Mwabi there saying, I do think South African government needs to extend this lockdown now that coronavirus cases are increasing every day. Still, more people need to be tested before we go back to normal, which is in agreement with what the professor has been saying. And Exquisite saying, I think President must come up with a plan B, like testing people on the malls, taxi ranks, and in their place of work. This lockdown can't continue. 21 days is enough. All right, thank you so much for those interactions. But let's go back to our guests tonight, Professor Shabir Madhi and Dr. Kgosi Letlape. Gentlemen, let me thank you once again for staying with us this evening. Let's go to that conversation about the mobile testing units and the sampling units and how that rollout is working. Are you satisfied? We saw different premiers today make sure that they start these processes where there have been confirmed cases as opposed to just throwing shots in the dark. Professor Madhi, your thoughts?
Yeah, so I think the approach that's been taken is sort of identification of probable hotspots in the country. That is where we see a high density of cases. Target areas in terms of aggressive monitoring or surveillance for possible cases of people that are infected with the virus. So the sort of hotspot approach is exactly what is required to be able to maximize the opportunity that we've got over the next 10 days or so when lockdown is still in place. So I think it's a correct approach. The key issue now is what sort of community buy-in we're going to get of people coming forward to say that they are symptomatic and that they want to be tested to find out for their own well-being as to what is their health status, as well as to protect the other individuals that they're living with in households. So I think people need to be forthcoming in terms of wanting to be tested, where the testing is being rolled out.
You're talking about watching out for people who are symptomatic, and I'll come back to you about how we encourage people who are asymptomatic. But Dr. Letlape, you were talking earlier about limited resources, only 67 mobile testing stations available. What your thoughts so far about the government strategy in how to roll out this drive?
I think the strategy is sound within the available resources. But we also need to be more creative and see how we can use other resources. There are lots of independent private practitioners, in particular general practitioners that are out there. And hopefully going forward, the government might think of how it engages them in expanding the sites for testing by making testing kits available to them so that they can test people that meet the criteria set by government at places that are near to where they live so that we can expand testing. But as has been said, we can't just test anybody and everybody. It has to be people that are symptomatic or people that have been in contact with a known COVID patient or a suspected COVID patient that turns out to be positive. But we've got to do it as widely as possible in all the geographic locations. I mean, we have people that have been positive that have run away from Gauteng, sat in a bus, went to Limpopo. So all those people that are in the bus would need to be traced so that they could be offered testing. That's the extent to which we need to be using it. But we should be impressed with what has been rolled out. What also needs to come to the party would be the relevant authorities in approving the rapid test that have a quick turnaround time, testing them, ensuring that they are sound, reliable, and launching them. People are now talking in other parts of the world about tests that are, at a point of care. Test takes 15 minutes to get a result. We need to ensure that we have access to that. But remember, this is a pandemic, so we are competing with rich nations for scarce resources. But I commend the government for the testing that has been rolled out so far. And we hope more test kits are made available so that the testing could be even wider.
It's a very conversation that you're raising, important conversation you're raising, Dr. Letlape, about the rapid testing kits, especially in that conversation we have about people self-isolating at home and the practicality of that. Professor Mahdi, how far are we in terms of this conversation?
Okay, so I think we need to be careful in terms of which rapid diagnostic test we're referring to. So there's one molecular rapid diagnostic test, which sort of gives you an answer in about 15 minutes. And that is now being rolled out in the United States particularly. Unfortunately, that particular technology is not available in the country. There are a number of other rapid tests which are being developed, which people are putting forward as possible point of care tests. But again, those tests have not been validated. The only tools that we've got currently to be able to identify whether an individual is infectious or not is what we call a PCR test, or molecular-based assay. And there's a number of different technologies that can be used to do this molecular detection of the virus. But that is the only tool that we've got available to us. So like I mentioned, there's a number of individuals, number of companies that are working on developing rapid diagnostic tests. But at this point in time, there isn't anything else available to us besides what is currently in the country.
Right, we've spoken at length about testing mechanisms and how we're going about that, but the other big conversation is about finding a resolution to this virus, the uneasiness around vaccinations and their side effects, and the possibility of South Africa or parts of Africa being used as testing grounds for a COVID-19 vaccine. Are these concerns valid, Dr. Letlape? How transparent are these processes, and how can the general public discern in terms of the intentions of scientists in a rush to find a vaccine?
I think one of the problems that we have is not maximizing on what is available to us to cap this epidemic or this pandemic. The issues of vaccines, as the professor will tell you, they are not issues for now. If we're lucky, we might have a vaccine in a year to 18 months' time if it's accelerated. So people should not put their hopes in things that are not there. Let's live in our reality and do what we can do, which is in all our hands. Hygiene, physical distancing, cough etiquette, those are important issues. We tend to concentrate on problems, on what can be done, rather than on what we can do. We'll always speak about the challenges of isolation. Let's start by the government has come up with a mechanism to try and identify people that would need to be isolated. So if you do not have the means to self-isolate, the government has gone to a lot of effort to create places where people could be isolated. Hospitals, there are facilities. There's a plan to turn Nasrec into a COVID center. So when people are not able to isolate, the government is prepared to take the people that need to be isolated and isolate them on behalf of the nation. So let us concentrate on the things that we can do. That's how we get out of this. We shouldn't dream about things that even first-class nations, rich nations, it's out of their reach. The key to this is on the epidemiology side. On the therapeutic side and the testing side, the government is doing well. What society should concentrate on is what each and every one of us can do to cap the spread of the epidemic. And my advice would be, let's work as individuals on the basis that if I behave like I'm positive and I care about others, what would I do? I would physically distance myself. I would cover my nose
and mouth. I would be pedantic about hygiene. I would have a proper cough etiquette, and I would wash my hands properly at every conceivable opportunity. That's how we kept this epidemic. I would respect the rules in terms of lockdown. I wouldn't gallivant. If I'm not an essential worker, I will stay home and rekindle the relationships at home. If I'm an essential worker, I will also stick to the rules around how I move. I go to work, I come back, I don't visit friends. The other issue that would need to be attended to is the issue of food security. And I hope in the next phase that will be looked at seriously from the relevant clusters in government.
Professor Madi, are you in agreement that it's a bit premature to be having a conversation about vaccines?
Certainly not. So I think the reality of the situation that we face to us is that there's only one way that we're going to be able to contain this virus to the extent that we want to contain it. And it's worked for every other disease that we've come across, and that is by way of vaccines. So it's not going to be a vaccine that's going to be available to us in the next 6 months or the next 12 months. It's probably going to be about 24 months. And it's really unfortunate that the utterances of 2 scientists in France has cast such a cloud in terms of the need to evaluate vaccines, not just in high-income countries, but also in low-middle-income countries such as South Africa. If we want to know how well these vaccines work in our own context, it's important for us to actually go out and work with companies that are producing these vaccines for clinical trials to be done in South Africa so we can understand how the vaccines work in our own country, and then we are prepared to actually adopt those vaccines when they become available. So vaccines is really the only strategy that we've got in our toolbox to be able to eventually contain the spread of this virus and to be able to contain the amount of disease and the amount of death that this virus is causing. In the absence of a vaccine, the default path is to rely on what we call herd immunity. Now, for herd immunity to emanate against this particular virus would require about 2/3 of the population to be infected. And when 2/3 of the population are infected with the virus, they start developing an immune system, an immune response to the virus, which protects them once they become reinfected from developing severe disease. And it also limits the ability of the virus to transmit from one person to another. So the options that continue on our current pathway in terms of allowing for the virus to continue spreading in society, and that might take 2 to 3 years before we reach that 2/3 level to be able to get herd immunity, or we need to accelerate that herd immunity by way of introduction of vaccines that are firstly to be safe, most importantly, shown to be safe and to be effective. So the agenda for the development of a vaccine is of utmost importance. We don't have any other tool available to us other than natural herd immunity, which is going to be able to accomplish what vaccines would be able to accomplish. And vaccines essentially basically will be able to do that at much less cost in terms of loss of life than allowing for natural immunity to run its course.
I know you're both medical professionals and you don't work on speculation, but on science. But why, just to indulge me a bit here, why do you think South Africans are so suspicious in terms of the possible producers of a possible solution, a possible vaccine? Dr. Lekape?
I think historically we've had the issues of tests being done on communities that can't benefit, which are being done for the benefit of others. So there is history about being suspicious. But having said that, I fully agree with what the professor has said about the importance of looking for a cure and looking at vaccines. But I'm saying from a population perspective, we need to play our part now in terms of curbing the spread of infection, because that is key and that is what is in our hands. It does not mean that science is going to stop and not look for the solutions. The solutions, as he said, are 12, 24 months away. But we can now not do what we can do now to stop the virus and to flatten the curve whilst waiting for other solutions. We must forge ahead with all the actions to do what we need to do. Now, the issue of mistrust is just based on we don't want to be used as guinea pigs But as you can see, from the scientist side, we are engaging. There's a trial now looking at drugs, for example, that might offer shortening the course of the disease. And we're part of the solidarity trials that are being done, coordinated by WHO. We can't be used as guinea pigs, but we will participate in multi-center trials, protecting our population and participating in the frontiers of finding medical solutions to the problems that we have.
All right, we need to take a break, but when we come back, we'll continue this line of conversation with Professor Mahdi. You're watching Unfiltered. Stay with us.
Right now, it's kind of relaxed, but I'm a little bit concerned that we're going to see an upsurge in the next 2-3 weeks.
We're trying to engage with the community so that we can make them see the importance of hygiene, washing your hands in terms of cutting the spread of the COVID. We're also designing reusable filters that are actually of medical grade quality that our healthcare workers will be able to autoclave and sterilize and reuse.
Developments of this kind, they don't only stop with this, but we widen the scope of collaborations.
Patients need to stay home. It's very, very important. Isolation and quarantine is your safest bet. And you make sure that once you don't have it, you don't have it to spread to others. So limit exposure, practice safe sanitation, washing, and keep the social distance, but importantly is mask up and prevent the spread.
Welcome back, and we're entering the final stretch of this show tonight, and South Africans are really invested in the topic tonight, and as to be expected. Let's listen to some of the voice notes you've sent through.
Extend the lockdown, but at the same time, even if you extend it and the government only deploying 3,000 soldiers, it does not make sense. The government must deploy more soldiers in the township, and this spreading of those fake videos when soldiers beating people, I think you must watch with other countries, e.g. like Zimbabwe is controlling much better than South Africa. So on this stage, to extend it, I support it.
I honestly feel like you guys shouldn't extend the lockdown period because South African kids are missing out on their education, whereas if the lockdown is extended, the kids will be forced to redo all their grades, hence the syllabus won't be finished, so that's going to cost the country very greatly.
My name is Isaiah Mudipani, calling from Mafikeng. Yeah, as much as I understand the economic implications coming with a lockdown, it is really in the best interest of the citizens for a lockdown to be extended. Otherwise, all the offers made in these 21 days will be really down the drain because stats will rise in terms of new cases, no matter what.
As alone, I wanna go to school. My parents, they wanna go to school, and mommy and daddy, they wanna go to work.
And we end a listen to those voice notes with that very necessary voice in our community of young people and how they feel about this whole process. But Professor Mahdi, before we went to break, we were having that conversation about South Africans, the citizens and their suspicions around possible solutions in terms of finding a vaccine. Why do you think that is?
Yeah, so I'm not too sure that's actually a correct assessment. So I've been involved in the development of vaccines for the past 23 years. And I've always been astounded at the extent to which communities volunteer to actually participate in the clinical trial. So myself, I've been involved in 3 studies: pneumococcal conjugate vaccine, which protects against pneumonia; the rotavirus vaccine that protects against tidal disease; RSV vaccine that protects against another form of severe pneumonia that occurs mainly in children. These were the first studies on an entire continent and in any low-middle income country where these studies were done. It was done in Soweto, in South Africa. we had absolutely no problems in terms of mobilizing the community to participate in the studies. And the net result of that was that South Africa was the first on the continent to be able to introduce those life-saving vaccines into our immunization program. When it comes to HIV vaccines, as an example, we don't have much difficulty in terms of enrolling participants into those studies. It's a matter of community engagement, getting them to understand the value of the vaccine. And without failure, my experience has been the community has been very forthcoming in terms of participation in these sort of clinical trials, which then allows us to make informed decisions in terms of the introduction of those life-saving vaccines into public immunization programs. So I think it's somewhat of a misconception to say that there's public mistrust in terms of what the scientists are doing when it comes to evaluating vaccines that we know are of importance to the South African context.
Professor Madi, I suspect you're not on social media, because if you had seen the conversation of over the weekend, which, you know, much of this question stemmed from in terms of the suspicion. But here's another matter of curiosity, and I'd like to ask both of you. KwaZulu-Natal accounts for 6 of the 11 COVID-19 deaths, even though the province's infection rate is third behind Gauteng and the Western Cape. Why is this the case?
I think the important thing to appreciate is that it's very difficult to make much of small numbers. It's really when the numbers start increasing that you can be sort of scientific in terms of the assessment. Right now, it might well be that the few people with comorbidities were more likely to have lived in KwaZulu-Natal than in Gauteng. In Gauteng, it might have been that the majority of individuals that have been tested are otherwise healthy individuals. We know many of them were travelers to other countries. They came back otherwise healthy. So it's really sort of, it's difficult to make any sort of assessment in terms of the small numbers of deaths that have occurred in the different settings at this point in time.
Dr. Letlape, your thoughts about the mortality rate in KZN?
I think you can look into it and find out what the issues were. The first cases that came from Italy, when it was imported from Italy, it might be that their relatives and their parents are in KZN. So when you have young people coming in and they go home and they pass it to their family, the elders in their family would be the ones that are susceptible. I don't think it's anything special that is happening out there. It can happen anywhere. The numbers are also too small for us to be thinking about any particular patterns. I think it's just the throw of the dice, where the people that came out had contact with people that were vulnerable, that were in KZN. The people that have demised there are, a few of them are older people.
Okay, we have 2 minutes left to the show, and I'm going to give a minute to each one of you. You can answer my question, or you can find your own way of concluding this conversation. But there's that conversation about expertise in South Africa, as we have a conversation about vaccines, about ventilators, and constantly having to look outside in terms of solutions. Are we having problems in terms of these expertise in South Africa? Let's start with you, Professor.
So I think the reality is that to develop a vaccine is a really complex process, and not something that it's not an expertise that develops overnight. So South Africa plays a certain role in terms of the clinical development of vaccines or the clinical development of therapeutics, but not necessarily in the actual establishment or creation of these vaccines. But South African scientists are very well, highly regarded in terms of the role that they play in terms of clinical development of vaccines in general.
Dr. Letlape?
I think expertise is plenty in South Africa. What might be lacking is the commitment to fund research. We're spending too little of our GDP or of our budget on research, and that's where the problem lies. If we can devote more money to research, the brain power lies here. You'll find a lot of people that move from here to go and practice elsewhere because they are given resources. In terms of expertise and brain power, it's plenty, but we've got to put more resources into funding research
And that's where we're going to end it. Thank you so much to both of you, gentlemen, for taking part in this conversation tonight. Professor Shabir Mahdi from the Vaccinology Center at the University of Witwatersrand and Dr. Khosi Letlape. Thank you to both of you once again. We're running that poll tonight, and let's take a quick look at the results. Will South Africa be forced to extend the national lockdown? 53.2% of you say yes, 32.3% no, 21 days was enough, and 14.5% not really certain. 4,221 votes have come through in this conversation. Thank you so much for being invested in it. Thanks for watching Unfiltered. Let's see you again next week, Monday. Bye-bye.